Naloxegol tablet is used to help relieve constipation caused by taking opioid medications for ongoing non-cancer pain. It works by blocking the effect of opioids on the gut without affecting their pain-relieving effects. Naloxegol belongs to a group of medications called opioid antagonists. The recommended daily dosage of Naloxegol tablet is determined by a healthcare professional, and it is important to take it exactly as prescribed. It is usually taken once daily, with or without food. It is best to take Naloxegol tablet at the same time each day to help maintain a consistent level of the medication in your body. Before taking Naloxegol, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth on an empty stomach at least 1 hour before or 2 hours after a meal, as directed by your doctor, usually once daily in the morning. If you are unable to swallow the tablets whole, you may crush them and mix the powder in water. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Naloxegol is used only for constipation caused by opioids. Use this medication regularly to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Stop using this medication when you stop taking opioid pain medication unless otherwise directed by your doctor. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Stop taking other laxatives before you start treatment with Naloxegol. Tell your doctor if your constipation lasts or gets worse. Some common side effects of Naloxegol tablet may include stomach pain, diarrhea, or gas. If these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to note that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. In some cases, opiate withdrawal symptoms may occur. If you experience symptoms such as sweating, chills, stomach pain, diarrhea, yawning, or changes in mood, notify your doctor immediately. Although rare, this drug may potentially cause a serious tear in the stomach or intestinal wall, perforation. Seek medical assistance right away if you experience severe abdominal pain, fever, dizziness, fainting, or nausea and vomiting. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects. If you notice any other effects not mentioned here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Naloxegol, it's important to talk to your doctor or pharmacist if you have any allergies or if you're allergic to any of the ingredients in the medication. It's also important to discuss your medical history, especially if you have any stomach or intestinal issues, kidney disease, or if you're pregnant or breastfeeding. Naloxegol is only recommended during pregnancy when clearly needed and may cause opioid withdrawal in both the mother and the baby. It's also uncertain if this medication passes into breast milk, so it's important to consult with your doctor before breastfeeding while taking Naloxegol. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications you're currently taking, including prescription drugs, non-prescription drugs, and herbal products. It's important to be aware of potential drug interactions that may affect how Naloxegol tablet works in your body. Other medications, such as adagrasib, azole antifungals, clarithromycin, cobicistat, indinavir, nifazodone, nalfinavir, rifamycins, ritonavir, and tipranavir, may impact the removal of Naloxegol from your system, which can in turn affect its effectiveness. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Also, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Naloxegol and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to take naloxegol exactly as prescribed by your doctor. It is usually taken once a day with or without food. The dosage is based on your medical condition and response to treatment. It is best to take it at the same time each day to help you remember. This medication is used to treat constipation caused by opioid medications. It works by blocking the effects of opioids on the gut without blocking the pain-relieving effects of the medication. This medication should be taken on an empty stomach at least 1 hour before the first meal of the day or 2 hours after the last meal of the day. The recommended daily dosage is 25 mg once daily. If you forget to take a dose of Naloxegol tablet, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Naloxegol tablet at room temperature and away from light and moisture. It's important to keep it in a safe place where children and pets cannot access it. When it comes to getting rid of the medication, do not flush it down the toilet or pour it into a drain unless you have been specifically instructed to do so. Instead, make sure to properly discard the product when it expires or when you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to dispose of Naloxegol tablet. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.